cervix is very important. So usually either inflammation or the malignant condition, it arises in the cervix. Okay. So I don't know how to go back again. Hey Bhagwan. Picture you can see the uterus. It is the uterus along with the fallopian tubes, bilateral ovaries, and cervix. Here you can see the lower part of the uterus. Okay, that is the cervix, and cervix is it comprises of the endocervix, that is the inner part of the cervix, and the ectocervix, that is the outer part of the cervix. Okay. So grossly also, when you look at the cervix, you can make out the endo and ectocervix. Similarly, the lining epithelium of the endocervix and ectocervix also differ in the histology. Okay, the endocervix is lined by columnar cells, ectocervix is lined by stratified squamous epithelium. Okay, this is the gross specimen of the uterus along with the cervix. The lower part is the pale color, shiny. Okay, that is the mucosa of the cervix. And in the second picture, you can see the uterus is cut open. Okay, and here you can see the lower part, which is the cervical part or the cervical opening, that is connected with the endometrial cavity of the uterus. Okay, so any infection of the cervix, sometime it can go high up to the endometrium of the uterus. So it can be either acute or chronic cervicitis. Okay, and basically the organism could be streptococci, enterococci, many times E. coli. Okay, they can form the normal cervical flora also, E. coli usually, but other organism like streptococcus, enterococcus, staphylococcus, they can cause the inflammation of the cervix. And in the normal vagina, okay, and in the cervix, there will be presence of lactobacilli. Okay, they are the organism, they are the normal flora, so they are not going to harm the body. These lactobacilli, they produce the lactic acid and they maintain the vaginal pH below 4.4. 4.4 pH, it is acidic. Okay, so that is very important to maintain the normal, healthy, okay, cervical tissue. So that maintains the cervix, and it also suppresses the growth of the other pathogenic organisms. Right. So at this low pH, these lactobacilli, how they prevent the growth of other organisms? That is by producing the hydrogen peroxide. Okay, which is very bacteria. When the pH will be chance that the other this pH aware that we have two group of herpes simplex viruses, 1 and 2. One causes the oropharyngeal infection, and 2 it mucosa inflammation. Okay, it is involved with the inflammation of the genital region. And clinical symptoms, they are seen in 1/3 of the individuals, those who are infected. You can see basically the ulcers, okay, red color, very painful ulcers, and other you can see over the vulvar skin, okay, over mucosa, also in the cervix and in the vagina. So how does the patient present? How do they present? They present with abdominal pain, okay, lower abdominal pain, which is basically a pelvic pain, and they give history of per vaginal discharge, purulent discharge. Okay, then other associated symptoms will be pain, urination, micturition. They will have problem. Okay, urine retention will be there. fever, malaise, and sometimes there will be inguinal lymph nodes. Okay, inguinal lymph nodes, they become enlarged and they become tender, painful. And when these ulcers, okay, they are when they are very active, okay, they can also transform the disease to other very easily. These viruses, they can also migrate to the nerve ganglia like lumbosacral nerve ganglia. Okay, and what happens is when the immunity is very strong, we cannot do anything. But when the immunity is suppressed, okay, that time these viruses which are based on the ganglia, okay, they can be just sometimes they can get reinfected. Okay, so the reactivation will be triggered. That's why these people who had one infection with all these organisms, they can have recurrent infection. They have high chance of recurrent infection. And when you talk about herpes simplex virus 2, they are more likely to recur more commonly than herpes simplex virus 1. Okay, women are more susceptible to transmission than men, and it is also transmitted during the
Ma'am,
childbirth. Yes,
slide change भइरहेको थियो
what happened? Not able to see the slides?
अघि चेन्ज भइरहेको थिएन अहिले भयो म्याम
Okay, okay. If any problem, I can send you my class PowerPoint. Okay. एकदम धेरै गाह्रो कुरा पनि छैन नि सकिसकेको छ if any doubt one of you can just write to me and then I'll send you the link to my PowerPoint. Then I told you this neonate, okay, during the childbirth also it can be transmitted from mother to child. Okay, and diagnosis you can do by the culture of the vaginal discharge exudate. To look for the viral infection, you can do polymerase chain reaction (PCR). Okay, and you can go for enzyme link immunosurveillance assay and direct immunofluorescent antibody test. Okay, so basically for treatment we go for antiviral treatment, right? The viral like many times it gets treated on its own. It takes several days to weeks, okay? But in symptomatic cases, we usually give them antiviral drugs. There is one more infection, not very common, but which can occur, which is called as molluscum contagiosum. Okay, it is a pox virus. Okay, it is a pox virus, and the infection it can occur in the skin and mucous membrane. It can be seen over the face, over the abdomen, buttock, or in the genital region. Very commonly seen in children and it appears pearly, okay, pearly look with dome shaped papules, and it has a dimpled center and very diagnostic feature you will see in the microscopy you will see molluscum bodies, okay, those eosinophilic round globules which are seen in the deeper tissue in the microscopy, okay, they are the molluscum bodies. Then other infections are fungal infection. Among the fungal infection, candida infection is very common, okay, in the genital region. And this candida fungal infection is associated with diabetes, mellitus, prolonged intake of antibiotics, pregnancy, okay, and it is usually not considered a sexually transmitted disease. So if there is any change in the pH or any medication if the patient is taking also, you can see the fungal infection. And a patient usually present with vaginal discharge, and that is also cord-like vaginal discharge. Then the other is a protozoan infection, that is Trichomonas vaginalis, very commonly seen. Okay, it is a sexually transmitted disease. Patient will present with again the pelvic pain or lower abdominal pain and vaginal discharge. And in this case, when the gynecologist, when they do this colposcopic examination, okay, to see the cervix, to see how the cervix look like, the cervix, they appear very red in color, very congested, okay, pyruvate appearance. and it is considered as the strawberry cervix because of the look of the cervix. It is called as strawberry cervix. Okay, so here in this picture you can see the fungal hyphae and the spores. Okay, in between the epithelial cells, those are the thread-like thing. They are the hyphae, and those eosinophilic, that ovoid color thing is the spores. This is trichomonas. Okay, with flagella, you can see flagella and tail. And in the lower picture, in between the epithelial cells, these trichomonas, they are usually seen in clusters. Here you can see 4 to 5 cells. Okay, that blue color with the flagella, those clusters you can see, and sometimes they are seen singly also. Then coming to other infection, okay, that is Gardnerella vaginalis. It causes bacterial vaginosis. In this also patient present with vaginal discharge. It is very fishy. The odor is very fishy, and the discharge is usually green to grayish in color. And just like trichomonas or fungal hyphae, which we were seeing in audience infection, here you are seeing the cocobacilli. Okay, normally you see lactobacilli in the pap smear, but if the patient is suffering from Gardnerella vaginalis infection, you see cocobacilli, and these cocobacilli they are studded over the epithelial cells, which are called as clue cells. Okay. I think for this you can just remember the name. Okay, urea plasma, urea lyticum, mycoplasma, and chlamydia trachomatis. So these last two organisms they can always interfere with the normal pregnancy. Okay, and the inflammation of the other part of the uterus apart from the cervix. Right. To normal pap smear picture, you can see in the above that first one. In the lower picture, you can see the epithelial cells, which is almost covered by the clucil, cocobacilli. They will be small rod-shaped bacilli. Okay, they are sticking to the epithelial cells, and when they almost cover the whole of these epithelial cells, they are referred as clue cells. So when there is presence of these clue cells, we can think of bacterial vaginosis. Okay. Now those were the infection in the cervix. So apart from the infection, okay, cervix is very important organ because pre-malignant lesion and malignancy can occur in the cervix. Okay. So earlier days, carcinoma of the cervix was the leading cause of cancer. Nowadays, it is still, but the number has decreased. Okay, it has declined because of the early detection of the pre-malignant lesion as well as the carcinoma of the cervix. अनि केले गर्दाखेरि यो रिडक्सन भएको छ त because of the screening test. You might have heard about the camp, होइन, cervical cancer को क्याम्पहरू गर्यो भनेर सुनेको होला. So in those camp, what they do is they do the screening test. They check the patient, and if they think that they need to be screened, then what we do is we do the cervical pap smear. Okay, so cervical pap smear is a screening test, okay, to detect the pre-malignant lesion of the cervix as well as the cervical cancer. So pathogenesis, it will be okay. I have combined the cervical intraepithelial neoplasia, which is the pre-malignant lesion, and CS cervix together. But I'll do it very briefly because this will be discussed. Carcinoma cervix class will be taken later. Okay, so pathogenesis, there is basis that it could be epidemiology, clinical pathology, or genetic studies. Okay? So all this suggests and support the pathogenesis of the pre-malignant lesion as well as the cervix. And for this pre-malignant lesion of the cervix and cervical cancer, the most common causative agent is human papilloma virus. होइन, त्यही भएर आजकल ह्युमन प्यापिलोमा भाइरसको भ्याक्सिन दिने भनेर यङ गर्लहरू, दोज हु आर 10 to 12 years old, बिफोर दे अटेन्ड देयर मेनार्की फर्स्ट पिरियड, what we do is we give vaccines to them. These vaccines not only protect the girl child from this carcinoma cervix. In many countries, like in I think in UK and in some part of America, it is given to boys also to prevent from the CA rectum, okay, and anal canal. So, human papilloma virus is the most important causative agent for cervical cancer and premalignant lesion, and it is a DNA virus. There are, I think, more than 200 types of this HPV virus. It can be either high risk or low risk. Basically, high risk HPV, they are associated with carcinoma of cervix, and among these high risk also, two are common: human papilloma virus 16 and 18. Okay, you just remember that HPV 16 and 18, they are the most important for cervical pathology. Okay, 16 alone can cause 60% of the cervical cancer. HPV 18, it accounts for the 10% of the cervical cancer. So these are the risk factor for the cervical cancer. If the sex life started very early, multiple sexual partners, okay, many things are there. This HPV infection, definitely it will be discussed in the next time. So these are the risk factor, and why I showed you this is to show that, see here, number 5, HPV is so important. It is considered as one of the risk factor. So genital HPV, they are very common. Okay, so 50% of the HPV infection, they are usually cleared within 8 months, and 90% of the infection, they are cleared within 2 years. Okay, and if there is infection with HPV 16 or 18, high risk HPV, okay, it can last for longer period, 13 months. Okay, the more it stays, okay, in the body, the more it lasts, there is high chance that it can cause cervical cancer. Okay, and this human papilloma virus, it can cause coilocytic atypia. So what is this coilocytic atypia is? It causes certain changes in the squamous epithelial cells of the cervix. Okay. So when there is coilocytic changes, what happen is you can see there is perinuclear halo, the nucleus will be enlarged. Okay. And that is considered as atypia, coilocytic atypia, and that is basically due to high risk human papilloma virus. Now, one thing which you have to remember is these HPV, okay, HPV viruses, what they do is they interfere with the tumor suppressor gene. Okay, so what are these tumor suppressor gene? Which suppresses the tumor, which helps our body to stop the growth of the tumor cells. So these two are the tumor suppressor genes, P53 and retinoblastoma. So human papilloma virus, it interferes with the function of the retinoblastoma and P53. Okay, and what you have to remember, the next thing is there are two type of viral protein. One is E7 and E6. E7 and E6. E6 interacts with P53 and E7, it interacts with the function of retinoblastoma. Okay, so when the function of P53 and retinoblastoma is interrupted, what happens? They cannot stop the growth of these tumor cells. So what happens? They become functionless. So there is more and more development of the tumor cells. Okay. So here these viral protein E6 and E7, when they interact with these tumor suppressor genes, there will be development of the premalignant lesion, which later develop into cervical cancer. Okay, this will be dealt in the CA cervix. Okay, we can just uh, omit this slide. I'll move on to the next slide. Cervical intraepithelial neoplasia. Okay, this is important. They might ask you short questions also, SAQ, about CIN. Short form, we call it as CIN. There are two types of classification. Oldest classification likhe gare thyo, CIN 1, 2 and 3 bane thyo. Okay, so basically cervical intraepithelial neoplasia भनेको Neoplasia, it's a new growth, but it is limited within the epithelium. It has not crossed the basement membrane. Okay, so it is neoplasia, but it has not crossed the basement membrane or epithelial membrane. And to make it easy for the diagnosis, this might is called high-grade SIL. That is high-grade squamous intraepithelial lesion. So for us at the present moment, what you have to remember is high-grade SIL. Okay, so when it comes to SIL, CIN 2 and 3, it is lumped sum together as HSIL, high grade. Most of the growth some intrauterine devices used that can also cause features likely of LSIL. Okay, and very small percentage of these low grade SIL it changes to high grade SIL. And this low grade SIL never progresses to invasive carcinoma. एकैचोटि low grade बाट carcinoma हुँदैन. Okay, though this low grade as well as high grade they are pre-malignant lesion. Okay, so what happens is usually low grade is changed into high grade, and then high grade will go for the development of the cervical cancer. And this high grade is very common when you compare this with the low grade. In high grade, this SIL, okay, there is progressive deregulation, okay, of the cell cycle by human papilloma virus, and as a result of this, it increases the cellular proliferation. It causes decrease in the epithelial maturation and low rate of viral replication when compared with low grade SIL. Okay. So morphology. The diagnosis of these SIL, it is based on the identification of nuclear atypia. I told you that is coilocytotic atypia. So here you can see that there is nuclear enlargement. The nucleus appear dark in color. The chromatin will be coarse, okay? And there will be variation in the size of the nucleus. And then you can also see perinuclear halo. Nucleus ko oripari you can see a clear zone, pale color clear zone. So these features they are called as coilocytic atypia. And if the atypical immature squamous cells, if they are okay, those dysplastic cells, okay, if they are confined to the lower 1/3 of the epithelium, it is considered as CIN1 or low grade SIL. If they expand more than 2/3 or involve the whole of the epithelium, it is considered as either CIN2 or CIN3, and it is graded as HF, high grade SI. Okay. So this is the normal cervix with the stratified squamous epithelial lining. Okay, it looks absolutely normal. Here, the lower 1/3. Okay, since I am taking class from mobile, I'm very sorry I cannot use the arrow. But here you can, I think I can, this red mark, can you see? This is the, okay, these areas. This is the lower 1/3. So compared to the upper part here, you can see it is very crowded, the nucleus, it appears more blue in color. So lower 1/3 is involved and it is CIN1. So it is CIN2. Okay. In CIN2, see this 2/3 part is involved. Okay. So you can see a very large size of nucleus. You can see that they are very crowded. Okay, but the upper part, this part is almost, it is normal. Now this is CIN3. Okay, the whole of the this one is involved. The whole is involved. Okay, So this is the basement membrane. This one is the basement membrane. Basement membrane has not been disrupted. These cells has not come down to the subepithelium. Okay, that's why it is called as intraepithelial neoplasia. Okay, so when whole of the epithelium is involved, it is called as CIN3. Okay, or high grade SIL. So this high grade, it has a very high chance that it can change into malignancy. So I think this is the last slide for today's class. So more than 80% of the low grade SIL and 100% of high grade SIL, they are associated with human papilloma virus, high risk human papilloma. Human papilloma virus 16 is the single most common HPV, which is detected in both categories of the lesion, that is both low grade SIL and high grade SIL. Although the majority of high grade SIL develop from low grade SIL, 20% of the cases of high grade develop de novo without the pre-existing LSIL. And these SIL, basically the high grade, it always progresses to invasive carcinoma, and it may take a few months or sometimes few years, okay, for the development of the cervical carcinoma. But nowadays, with the screening, with a very good screening program, we can diagnose these cases at a very early stage, so we can go for the different type of surgeries, okay, and it can be managed in a very proper way, okay, that is causing a reduction in the number of the carcinoma of the cervix. Okay, so most of the things are common in case of high grade SIL and CA cervix, like pathogenesis, the causative organism, the risk factors, and all. So this will be again will be revised in the carcinoma cervix class. And I will also like to tell you that the rest of routineहरू दिइसक्यो तिमीहरूलाई. One of you can answer me on mute गरेर.
रुटिन पाएको छ, दिएको छु, पाएको छ.
Okay, so रुटिनमा चाहिँ मेरो नाम छ है. My name is there for the rest of the classes, 4 classes, but I will be involved in some other exam. म अर्को ठाउँमा examमा जानुपर्ने भएर my classes will be taken by Dr. Rakesh. Okay, so today is Tuesday, Thursday, Dr. Rakesh, he will be taking the carcinoma cervix. Okay, and the rest of the classes till leiomyoma he will be taking. Okay. Okay, this ends my class. As already disturbed by all. I was also very new to this Microsoft class. Okay, if any doubt, you can write to me. Okay, if there was any problem or if I need to